Hello, Chris, and very welcome to my video blog.
Hi.
I've studied your YouTube channel and watched very many of your videos, and I'm very fascinated by your story. So I would like to know your story and the mission that you're on right now. So let's start from the beginning. What happened to you 13 years ago?
Yeah, well, first of all, Katarina, thanks so much for having me on, and happy to share my story. I share it often. So in 2003, I was diagnosed with stage 3 colon cancer. I was 26 years old, and I was rushed into surgery because that's what happens when you get a cancer diagnosis. You don't have time to think. Basically, medical professionals, doctors just told me, yeah, you've got metastatic colon cancer. We got to get you in surgery right away and get this thing out before it spreads and kills you. Let me correct that. They didn't say it was metastatic in the beginning. They just said colon cancer. So I had surgery. They wanted to get me into surgery like the next day, which is very common. So a lot of cancer patients, they're starting treatment, whether it's chemo or surgery or radiation, with just days after a diagnosis, right? The next day, 2 days later, 3 days later, you don't have time to even think about your life or your situation. And that's a problem because if you have cancer, we know that most cancers are caused by our diet and lifestyle choices. Some are caused by viruses and parasites and bacteria. Some are caused by environmental pollution. But a lot of them are caused by our diet and lifestyle, the Western diet and lifestyle. Most people don't know this, though. They're told by their doctor, well, it's just genetic or it's bad luck, and there's nothing you did to cause or contribute to your disease. Therefore, there's nothing you can do to help yourself, right? We are your only hope. Our treatments and our therapies are the only hope you have of living as long as possible, or possibly, slim chance going into full remission and living a long, healthy life. So they rushed me into surgery. I took out a third of my large intestine and the tumor and a bunch of lymph nodes, and they realized I was stage 3C, so I was metastatic. That's when they told me it's metastatic colon cancer, and that my next step was going to be 9 to 12 months of chemotherapy. And that was, that was a surprise, because the original conversation had nothing, chemotherapy wasn't even part of the original conversation because they thought it was stage 2. So a couple things happened in the hospital that got me thinking, kind of red flags. One of them was the very first meal that they served me in the hospital after cutting out a third of my large intestine, right, my colon, was called a sloppy Joe. Now, you probably don't have sloppy joes.
No.
This is a very American food. I think they probably originated in the Old West, with cowboys. But basically, a sloppy Joe is sort of like a concoction that you would make to feed large numbers of people, right? A bunch of soldiers or cowboys or kids at summer camp or cafeteria lunches. And what a sloppy Joe is you take, some kind of ground up meat. Usually it's beef, the cheapest beef you can buy, of course. It's ground up, and they kind of cook it and stew it in sort of like a tomato-y barbecue sauce, and then they get a hamburger bun, and you just kind of scoop it out, slop it on the bun, and that's a sloppy Joe. And they put this thing in front of me, and I'm just thinking, I was just like, really? A sloppy Joe? I couldn't remember the last time I'd had one. Probably, when I was a kid at camp, right? This is the worst cafeteria, just horrible food. And I was really surprised that they were serving this in a hospital to sick people, right? Here's the worst food we can come up with. Enjoy. And, the amount of money you're spending to be in the hospital, they should be serving you like, a 5-course meal. But anyway, so that was kind of a red flag, right? I was just, I just was so surprised that the quality of food was so terrible that they were giving sick people. The second thing that happened that was a red flag to me was the day I was checking out of the hospital, the surgeon came in and was talking to me about, my next steps. And I asked him if there were any foods I needed to eat or avoid, right? I instinctively wanted to help myself, right? Get better. And I wanted to avoid things that might hurt me, like, being totally clueless, right? I mean, I had stitches in my guts. So, I mean, everything I eat is going to pass through that area in my body. And like, I didn't want to eat something spicy and then dissolve the stitches or something, right? So, but his answer to that question was, no, just don't lift anything heavier than a beer.
Okay.
So at that point, I was kind of like, okay, that's it. That's all he said. That's all the advice I got from my abdominal surgeon. And, I'm just thinking, like, why doesn't the medical industry care about nutrition? I know it's important. Like, I knew the difference between health food and junk food. I actually worked at a health food store. Like, I knew about organic food. I knew, I understood that fruits and vegetables are healthy, right? And that junk food and fast food was not healthy. But, they just apparently didn't care, right? The hospital administration obviously didn't care. My surgeon didn't care. And he basically gave me permission to go home and eat whatever I wanted. But that didn't sit right with me, right? It didn't make sense to me. So we go home, and I started eating sloppy joes and drinking beer because I figured, maybe this is what I'm supposed to do. I'm kidding, of course. But my wife and I were in the first few days, really, after getting home from the hospital, I was on heavy pain medication. I was sleeping on the couch. I wasn't doing anything. I was just trying to get well. And but at some point, as I kind of sobered up, I really wanted to get off the pain. I just felt like I didn't want to be on these pain pills, and I didn't feel good about them. What I learned later was that morphine actually makes cancer more aggressive. And they're not telling cancer patients this, and they're giving them morphine, but morphine promotes metastasis. So it was just interesting that my instincts were telling me, get off of these pain pills, get off these pain pills. So I didn't finish them, got off the pain pills just within a few days. And at some point in that time, there's just those first few days, I was just thinking about my life and what was going to happen next. And I was thinking about chemotherapy. And, every time I thought about it, the idea didn't make sense to me. The idea of poisoning my way back to health. But I didn't know what else to do.
No. So
I prayed about it. My wife and I are Christians, we're believers, and we just sat on the couch and held hands and just praying, just talking to God. And it's at one point I just said, God, I don't know what to do, right? If there's any other way besides chemotherapy, will you please show me? And 2 days later, I got a book that came to me, landed on my doorstep, and it was sent to me from a man in Alaska. And this is a guy who was a business acquaintance of my father. And his name is Al Strawn, but he's not a person anyone would know or whatever. He's just a guy, right? Just a guy that runs a bank. And Al sent me this book, and the book was called God's Way to Ultimate Health. And so I'm like, okay, well, what's this? And then the subtitle to the book was A Common Sense Guide for Eliminating Sickness Through Nutrition. So that piqued my interest. So I start reading the first chapter, and just right away I learn that the author had colon cancer, was diagnosed when he was in his 50s, and was also had this background. He had watched his mother suffer and die through cancer treatment, and he basically was just, the treatment killed her, is what he said. And he'd also been a pastor, a church, Christian church pastor, and he had seen a lot of church members suffer through cancer treatment and die. And then he gets this diagnosis and made a decision, was really not sure what to do either, but didn't want to do chemo and surgery because he had seen how destructive they were. And he happened to have like a healthy, health nut buddy who said, you need to get on a diet that's like the Garden of Eden in Genesis, raw fruits and vegetables, and you need to drink lots of carrot juice every day. And so that's what he did. He converted to a raw diet, started drinking about 64 ounces of carrot juice every day. And in a year's time, his tumor was gone. The body healed.
Amazing.
Not a miracle. It's just
was this
healing.
a newly written book, or was it had a few years ago?
So I read this book. This was January 2004, and this man had gone through that in the late 70s.
Okay.
So it had been like 25 years, and he was still alive.
Yeah.
And he had gone on to start, after he got well, he had started speaking and talking about these things and wrote some books and whatever. So I just knew as I was reading this, I mean, after just getting in about a chapter or two, I was like, this is an answer to prayer. I mean, I was sitting on the couch just like tears coming down my face because I was so thankful that this had come to me. It was just a very powerful moment in my life where I just, when you feel like your prayer's been answered, it's awesome. And so I was like, this is it. I'm going to do this right here. This is what I'm going to do. I'm going to do a raw vegan diet. I got to find a juicer, I got to do exactly what this book says. So I called my wife and I was really excited about it. I was telling her like this book and the raw food diet and this guy healed his cancer. And she thought I was insane. I mean, she was just like, what are you talking about? Like you still have to do chemo, right? You're still doing chemo, right? And I'm like, no, I don't want to do chemo. Like, this is what I want to do. And minutes later, as soon as we got off the phone, other family members are calling me. We heard you're thinking about not doing chemo, and we're really concerned. You really need to do what the doctor says. This is very serious, and alternative therapies don't work. I know somebody that tried them and they died. And don't you think if there was something that worked better, don't you think they'd be using it?
Exactly.
And, I didn't know how to answer those questions, right? I'm like, I don't know. And so all of a sudden, my confidence in my faith was pretty much just shattered, right? By all these people around me telling me, no, that's wrong. That's a mistake. Don't do that. Right?
But you still decided to go through.
That was very difficult. So I decided anyway, well, I'm doing it. Okay. But I'm going to do it alone. Apparently no one supports me, but I feel so confidently that this is what I'm supposed to be doing. I'm doing it. So immediately I converted overnight to a raw food diet, bought a juicer, bought giant pounds of organic, 25-pound bag of organic carrots, and just like got after it. It was just immediately overnight, no excuses, 100% all the way. Yeah. And, but I still had this pressure from, people around me, to go meet with the oncologist. So I reluctantly agreed just to appease family members. And this is very common, right? A lot of cancer patients they're really just agreeing to appease everyone around them. They're doing things they don't feel good about, right? They're going against their instincts and intuition, just because everybody says they have to, right? And that is a huge mistake. And I tell this to cancer patients all the time. This is your life. Don't do anything you don't want to do. Don't do anything that you don't feel good about, that your inner voice, your conscience, your instincts, your intuition, your gut, whatever you want to call it, is telling you, like, don't do this. I don't feel good about this. Everybody knows that kind of that feeling you get in the pit of your stomach when something isn't right. And yet patients are ignoring that. And they're just saying like, okay, I'll just do whatever you say, doc. So I go to the cancer clinic with my wife, and we're sitting in the waiting room waiting to go back, and the TV's on, and it's on one of the morning shows in the, Good Morning America or the Today Show, one of these morning shows, and out comes Jack LaLanne. Are you familiar with Jack LaLanne?
No, I'm not.
So Jack LaLanne was a very, very famous, legendary health and fitness expert in the U.S. And he had a television show in the 1950s. It was black and white TV. and he had a television show about health and fitness, right? He was like the first guy to be on TV talking about health and fitness. And he comes out, and he's in his probably late 80s at this time, and he comes out and he's all fit and healthy in his late 80s, and he's talking about nutrition, and he's going off about the reason we're all so sick and suffering is because we're eating this processed food, junk food diet, too much meat and dairy, and we need to get back to eating, whole food from the earth. And if man made it, don't eat it. And it was on the television in the cancer clinic, and while I was sitting there, and I just couldn't believe it. I was like, I can't believe this is on right now. And I turned to my wife and I said, can you believe this is on right now? And she was like, yeah, that's pretty weird. Right? Because it was reinforcing everything that it was just starting to understand and believe, right? And so eventually we go back to see the oncologist, and he gives me the standard pitch, right? He says, look, you've got stage 3C colon cancer. You have about a 60% chance of living 5 years with treatment. And it immediately I was like, 60%? I mean, that's pretty close to 50%, and which is like a coin toss. And what if his statistics are wrong? What if it is 50%? I mean, like, I took statistics in college as I got a business degree. So like statistics are, I learned how unreliable they are, right? And meaningless they are. So even his 60%, number was not encouraging to me. And then, as he's talking more, we're asking questions. And the biggest problem cancer patients have, gosh, they've got a lot of problems. But let me just say, one of the biggest is when they go see the oncologist or the surgeon or whoever, their doctor, they don't know the right questions to ask, right? Their biggest problem on the front end is ignorance, right? They don't understand their disease, and they don't understand treatment. And they're completely relying on a person, a medical professional, to take care of them. This is someone who wouldn't know their name if they saw them tomorrow in the grocery store, right? Maybe tomorrow, but if a week goes by, they're not going to remember their name. And they're putting all their faith, hope, and trust in this person who's seeing, dozens and dozens of patients at any given time. I mean, dozens per day, right?
Yes.
And they don't know the right questions to ask. And so they don't even really ask very many questions. The average cancer patient just goes in, and the doctor talks to them and tells them what he wants them to know. And they ask questions like, am I going to lose my hair?
Yes.
Right? Is this going to make me sick? Can I work, while I'm doing chemo? Right? So, and those questions are useless. Okay. I asked a couple questions that completely changed the course of the conversation. The first question I asked was, what about the raw food diet? Because I was already on it. I'd been on it for 1 week. And he said, no, you can't do that. It'll fight the chemo.
Okay.
And I thought, wow, what does that mean? Well, later I learned what it meant. I didn't ask him then. I don't know why. I should have just asked him what he meant. But I learned later that they don't want you to eat a raw food diet because chemo destroys your immune system, and they're afraid that if you eat an apple and it has some bacteria on it that would normally be harmless, that it could cause a huge bacterial infection in your body because your immune system's been destroyed by chemo.
Wow.
Yeah, that's why they don't want you to eat a raw food diet. Plus, the raw food diet is an aggressive detoxification diet, and chemotherapy doesn't work as well when you're on a raw food diet because your body basically becomes very efficient at detoxifying, and it will kick the chemo out before it can do as much damage as it normally would.
Right.
So anyway, he said that, which got me thinking, and then I said, well, are there any alternative therapies available? And at that point, his demeanor really changed dramatically, and he became very arrogant and condescending. And he said, no, if you don't do chemotherapy, you're insane. And then at that moment, just sort of this wave of fear washed over me. And when you become afraid and stressed, your body starts pumping stress hormones.
Yeah.
You have a physical reaction to stress, and those hormones interfere with your brain function, right? That's why when you're stressed, you can't think clearly. It's like tunnel vision, right? And so he's talking to me, and he's kind of talking down to me and using fear, basically like, if you don't do what I say, you're going to die kind of stuff, right? And things just got kind of blurry. And so I don't really remember much about what he was saying after that, except this one thing that popped out, which was in the middle of his sort of rant. He said, "Look, I'm not saying this because I need your business." And I thought, what? Like, wait a minute. Whoa, 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 whoa. I was in sales, and this guy just used a sales technique on me called the push away.
Yes.
Right? And why is he even bringing up business? I didn't bring it up.
No.
He brought it up. And then I was thinking, this is a business, right? We've been conditioned to look at doctors as like the saviors of humanity, like that they're just like these selfless angels, right? That just care for us or whatever. And that's really a nurse. But the truth is, these people are in this profession. They might have started the profession because they wanted to help people, but a lot of them started because there's good money in it, right? And this is a man who, without patients, would not make any money. And so he needs a steady supply of new patients every week to keep the money rolling. I learned later that private practice oncologists, which is not applicable to your country, but whatever, in the US, private practice oncologists make up to 60% of their income from the profit off of chemotherapy drugs. They mark the drugs up, they buy them wholesale and sell them to you and bill you or your insurance company. And they make a huge profit margin on chemo. So there's an incentive for them to give you chemo, right?
Yes.
They're not impartial. Now, in other countries that have socialized healthcare, the doctors aren't paid that way. So they can be more objective.
Yes.
And they tend to be more objective. If they really don't think chemo will help you, they may just say, look, it's probably not going to help you.
No.
So the conversation went badly after that. And we left his office, and I went straight to the desk like a zombie, and made an appointment to get a port put in to start chemo in a few weeks.
Yeah.
I walked into that clinic confident, and I walked out of there terrified.
Yeah.
And that is the story that I hear from cancer patients over and over again. Cancer clinics are just like a fear factory.
Yeah.
And they use this fear of death to motivate you, right? To manipulate you to take immediate action, to say yes to the next treatment, whatever it is, to surgery, chemo, radiation, right?
Yes.
And there I was. I had just gotten sucked into it. And we walked out of that clinic and back to my wife's car and held hands in her car and cried and prayed through the tears. And it was a very, very low point. My faith and my confidence were badly shaken in that moment. But I just thank God, because I had several weeks before I was supposed to start. And in that, time period, the several weeks, I had just time to think, right?
Yes.
I had time to think. I had time to, and I kept, went home, I kept doing what I was doing. I kept eating a raw food diet, tons of fruits and vegetables every day, and juicing carrots every morning, drinking carrot juice all day. And I was feeling really good. And so my confidence, I got my confidence back, and I'm thinking, I'm just kind of thinking through everything, right? Because, when you're stressed, you make irrational, illogical, impulsive decisions,
Yeah.
right? But when you have clarity, right, when you're not stressed, you can step back and you can rationally assess your situation. And so that's what I did. I just thought about, okay, I got cancer. I got this book. I prayed and I got this book. And then this book is saying that the body can heal cancer, and it's explaining the reasons we have cancer and all the contributing factors in our diet and in our environment. And this book is saying that if we make these changes, that we can empower our bodies to heal, and that everything we need comes from the earth, right? And I believe those things. everything in there like just resonated with me. Like, this is not hard for me to believe at all.
What kind of changes did the book tell you to do?
Yeah, so I'll get to that.
Okay.
So, but right at the, in this time period where I was trying to figure out what to do, I had a couple things that, some tough realizations. One was, I was afraid of chemotherapy. Right, I was afraid to do it because I knew it would hurt me. I knew I would suffer, lose my hair. I was already really skinny, and I knew I would probably become emaciated, and I was afraid. And then on the other hand, I was afraid not to do it.